Well, then we can say welcome and thank you, Tim, and thank you, Jules, for wanting to participate. We are really excited about your book and also this unusual collaboration between a psychiatrist and a philosopher. That's really good to see. And my name is Anders. I'm a psychologist working here in Copenhagen area. I'm probably one of the first psychologists in Denmark to work with the integration. It's kind of new in Denmark, but it's more and more psychologists and psychotherapists are doing it. And Morten, you want to say a few
Yeah, I can basically tell the same story with the exception that I'm a psychotherapist. I'm a private practitioner, but I also offer integration therapy for people who've used psychedelics outside of therapeutic setting. And yeah, I guess I can add I've used psychedelics myself as well, and in my personal process, and releasing trauma, still doing all the work that comes with that. So yeah, and part of the work group of NPTM here. Yeah.
So basically, we had, as I told Tim, Martin, who's doing the technical stuff today. He's head of the Danish Psychedelic Society, where everyone can be a member, everyone with interest in psychedelics. And then like last year, we created like a professional subdivision of Psychedelic Society that are more for psychiatrists, psychologists, psychotherapists, and other who have cultural interest or legal different kind of professional interest in the field. So right now we are seeing that the field is becoming, I would say, more professional. More professional people are getting involved, and it seems like more and more people are discovering that there is a field, that there's research, there's a field, there's even business opportunities. But I know, of course, these things have been happening in the States and also in England for maybe a few years ago. But I think right now it's going on in Denmark. So yeah, but maybe we should just let you tell both of you the story of how this great and unusual collaboration came to be. I know you held a seminar, and that was, I think, the first time I heard of you. That was some of the YouTube videos with the people telling their stories, and then of course you released this book with some of the accounts, and also like with the introduction text on the concept of spiritual emergencies, and you also have your own personal story in here, Jules. So but I will just give the word to you, Tim and Jules, and if you could tell us just a little of the background on how this project came to be.
Cool, thank you. Thank you for having us. It's great to be here, and it's great to see you all. And look, there's so much I'd love to learn as well about where psychedelic therapy is in Denmark, about your own experiences. So I'm really looking forward to a kind of learning from you guys as well, and having like a group discussion, and we've got a right kind of numbers where we can have a conversation and learn. So I don't think Tim and I are just going to we're not doing a presentation. We'll just do a kind of Q&A, and we'll look forward to your thoughts and questions. Tim, should we introduce ourselves a bit? Very briefly, I'm what I call a kind of gonzo philosopher, which is I'm interested in like ideas and how they can help make our lives better or worse. Like the gonzo bit of that comes from Hunter S. Thompson, who called himself a gonzo journalist, because he would not just write about things, he would try them out himself. So I'm like that with ideas and practices. I like to try them out, whether that's kind of stoicism or ayahuasca and so on. And I work at, I used to work at a place called the Center for the History of the Emotions. And I've done things on like the history of CBT and how it comes from Stoic philosophy. Then I wrote a book about the history of ecstatic experiences and how people find ecstatic experiences in Western culture today. That first introduced me to the idea of spiritual emergencies. So there was a little bit in that book about difficult ecstatic experiences, like ecstatic experiences which are slightly potentially traumatizing and scary. Then after that book, I went to do an ayahuasca retreat, which was somewhat difficult and challenging, and that got me more interested in spiritual emergencies. And I then organized this seminar that you mentioned in 2018, after I'd come back and integrated this difficult experience. And I didn't speak there, and I wanted 4 people to speak there. 3 of them were people talking about their spiritual emergencies and what had helped them to cope with them, what had helped them to navigate these experiences. And then Tim also came and gave us a kind of spiritual, psychological, psychiatric perspective. So I'll hand over to Tim here.
Well, thank you, Jules, and thank you everybody for coming today in the middle of summer and beautiful light evening. And I was saying before everyone joined, it's just such a delight to be in the presence of Europeans again, because my God, it's been a long time. I haven't been to Europe myself since the pandemic. And also lovely to see Jules and just to bask in his kind of articulacy. And so I usually start off by saying that I'm a psychiatrist, but actually I need to stop saying that, because it's only a portion of who I am, although it defines my professional life. And I suppose I went into psychiatry for all sorts of complicated reasons, including, my own woundedness and my ancestral kind of history as well. But I came across the writings of Jung when I was a teenager, and there was something about the deep psyche, the collective unconscious, the power of symbolism that really spoke to me. And so that's really what drew me to psychiatry. I thought psychiatry would be like that, and of course it wasn't. I also spent a lot of time traveling when I was supposed to be at medical school, and I think that kind of opened me up to the world's spiritual traditions and other ways of thinking about things, and it stood me in great stead. Going through psychiatry, I became very interested in psychoanalytic treatment. I could see that the medication was sometimes really helpful, but so often it wasn't. So how to work with people for whom it wasn't. So that took me through psychoanalytic training, which I did in a group, and I found it really helpful and interesting, and I guess it smoothed some of my rough edges. So I met my wife, and she probably wouldn't have been interested in me if I hadn't been through that. But I knew that in some ways it was quite a superficial treatment. And then I suppose I had a bit of a midlife kind of crisis. Perhaps the word crisis is a bit too strong, but after my sister died when I was about 40, and a search for kind of meaning in some way. And that took me eventually, after a few false starts, to the work of Stanislav Grof, who was, I didn't quite appreciate it then, but he was the LSD psychiatrist and LSD psychotherapist, who was really most prominent in the 50s and 60s, when LSD therapy was not only legal, but it was really the cutting edge. Many people thought it was the future of psychiatry. So I trained with Grof, who was using a method called holotropic breathwork to mimic the psychedelic state. Some of the training, incidentally, was in Denmark, a place called Trondheim Strand, not far from Aarhus, which is a fabulous place. And so that really opened my eyes to, that brought me back more to the Jungian part of the psyche, the deep psyche, and the many very mysterious manifestations of that. And I guess there were 2 aspects of that in particular that grabbed me. One was how to access very early trauma. And by early trauma, I mean trauma that I personally didn't get anywhere near in my analytic training or in my analytic work with patients. And it seems to me that in expanded states and psychedelic states and spiritual emergencies, those aspects of deep psyche that are coming to the surface are those very, very early parts of ego formation, if you like, when our psyche is so kind of raw and fragile and tender and undefended, and is so is so vulnerable to these sort of massive sweeps of meaning that sweep in. I mean, you only have to watch a baby to see how intensely they feel meaning. And of course, it's over these primal wounds really that we erect our personality defenses, and those personality defenses are so, they're so basic to us, they're so difficult to work with. So I guess it's not surprising that most psychotherapies don't really go anywhere near them. And I think in psychedelic states, we actually do. But of course, it takes very careful handling, multiple exposure. You can be re-traumatized. But also, as we get to those very early structures, I think we can also get beyond ego structures, which is the other side of the coin, the area of transpersonal experience. So as Leonard Cohen would say, the chinks are what lets the light in.
To me, Tim, it's very interesting that you're a psychiatrist that really have a background in Jung and Grof. I mean, there are not too many psychiatrists with this background, but this kind of knowledge is seemingly getting more and more relevant right now with all the new psychedelic research and therapies, I would think. But still, I think there's really a translation needed maybe for all the insights from Jung and Grof to really be understood in modern psychiatry. That I just want to say that's one thing I find very interesting with your your professional profile.
I mean, I guess we'll get more into this as the conversation develops, but it's difficult for paradigms to change. And, the paradigm that brought me and Jules together really, that we're so interested in is the healing paradigm, which is so different to the doctor-patient paradigm. And I suppose you get into talking about patriarchal power structures and people's investment in the status quo, and just how very difficult that is to shift. And, I guess as many of us know, one of the positive things about psychedelics is they do sometimes have a potential to dissolve some of these historic boundaries.
Yeah, thank you. We thought of Jules, if you're okay with it. I mean, you shared your story both on YouTube and in the book. Maybe it'd be interesting just to have a little introduce people a little to what kind of experience you had, because I was actually very moved reading it. Because it really reminded me of some of my own experiences I had. I would say in these terms we are using right now, I would say I had myself like a spiritual emergency as like 20-year-old young man, and then again like when I was turning 40, and I think it's right out of the Jungian textbook. These big breakthroughs or transformations coming in the shifts of life,
Sure. Well, so I'll prefigure it by just defining our terms a little. We use this term in this book, spiritual emergency, which the Grofs kind of introduced. What the reason for that is, historically, there has been an argument over the nature of mystical experiences in psychology and psychiatry. On the one hand, you have people saying Christianity or a New Age culture who will say that ecstatic or mystical experiences are totally good and wonderful, and lucky you for having them, and it's all angels and light and unicorns. On the other hand, you have in the history of psychiatry, people who say mystical experiences are pathological. They are delusional. They are a symptom of mental illness. You'll know this. People like Jean-Martin Charcot, the father of neurology, who said in the late 19th century that all ecstatics and mystics are mentally ill, from Socrates to Joan of Arc to Muhammad. And similar kinds of things were said by Henry Maudsley. We still have the famous Maudsley Institute in the UK and so on. Freud saw it as just ego regression and so on. So this was and that still was, and it may be, I don't know, Tim can tell us if it to some extent still is the case in psychiatry. So since you had a few people like William James and then Stan Grof who tried to find a middle ground and say ecstatic experiences, spiritual mystical experiences can be very positive and lead to flourishing and growth and meaning and maybe even connection to the divine, but they can also be difficult, scary, maybe traumatizing, confusing, disorientating. So trying to find that middle ground between totally pathological or totally wonderful. And I think that's a really useful thing to try and, you know, acknowledge the ambiguity of these experiences. They can be both, and we found this in the people who wrote about their accounts in our book, they can be both beautiful and terrifying, both meaningful and bewildering, all of these both and kind of things. So spiritual emergency means, the Grofs tried to use this term to distinguish some experiences from just, I don't know, completely, you know, it gets into hard to distinguish it from other types of psychosis, but we can have a whole argument about, or discussion about the extent to which you can distinguish some experiences, say, these are spiritual emergencies, but this is just common garden psychosis. But this is what they were trying to do. They were trying to say that some experiences, particularly experiences after like deep meditation or psychedelics, involve aspects of like psychosis or like mania or maybe visions, disorientation, which can last for like weeks or months. But if properly navigated, these experiences can lead to greater wholeness and flourishing. So, you know, you have, most people after like a good trip might have a spiritual emergence, you know, maybe some kind of transition to a new kind of sense of wholeness or meaning. A spiritual emergency is that kind of journey, hopefully towards greater flourishing, but it's a bit of a bumpier journey. So that's basically the kind of rough definition, you know, rough and quick definition. In terms of my experience, I did a lot of psychedelics as a teenager in a very unheld, unguided way, throwing together whatever drugs I could buy at a rave with people I didn't know very well, far too kind of young and so on. And I had a couple of traumatic LSD trips when I was 18. I didn't talk to anyone about these difficult experiences, didn't seek help, and developed post-traumatic stress and social anxiety. I was then helped in my late 20s and 30s by things like CBT and Stoicism, very rational approaches to flourishing. But as Tim said, I had a sense that other, maybe non-rational forms of therapy could help to heal me at a deeper level. So when I turned 40, I go off into the jungle to try, to try psychedelics again, knowing there was a distinct possibility I might have a bumpy experience, that this old trauma might come back, that it could be scary. So I picked an ayahuasca retreat center, which had a good reputation. There were kind of both indigenous shamans and Western therapists. There was a place called the Temple of the Way of Light. Quite pricey, by the way, like $2,000 for a kind of 10-day retreat. So this says something about psychedelic therapy. It seems to be only open to the kind of well-off at the moment, right? With some trepidation, I kind of took part in these, 5 ceremonies. You drink ayahuasca. I hadn't done psychedelics for 20 years. The first couple of ceremonies I had, the medicine, as they say, was quite kind to me. And I came away thinking, this is great. I can handle it. I'm totally, I've grown so much, no problem. And then the third and fourth ceremony were kind of more powerful. One of them, very quickly, I came up and went completely out of my body and forgot my name, where I was, what I was doing, I just had the sense of, I've gone way too far. How do I get back? And then I suddenly remembered, oh, I'm a human. Oh, I have a body. Oh, I took ayahuasca, all this kind of thing. So it's pretty powerful stuff, ayahuasca. Anyway, on the whole, the retreat was a positive, wonderful, heart-opening experience. I felt extremely connected, by the way, to the other people on the retreat, almost kind of telepathically connected, which is quite common with psychedelics. We then came back to this town called Iquitos, where we'd started off with, in the Amazon jungle. At that point, I basically started getting into trouble, psychological trouble, after the retreat, not during it. It was at that point that trauma, basically, it felt like a kind of repeat of my bad trips from when I was 18. I felt highly dissociated, completely, my heart very closed, couldn't really communicate with the people around me. Time went very strange. And I felt quite frightened and disoriented. And to some extent, like so dissociated, I felt like I was a bit in a dream. And I thought, God, what's going on? I'm not on ayahuasca now. And I remember looking at the kind of material of this retreat center sends us about integration. And it said, some people can have, you know, difficulties arising, and these can last for days, weeks, months, or years. And I read this in my head, like, years? What? I'm sorry, how long is this going to last? So I went to bed that night. By the way, all things like electronic equipment wasn't working either. My phone stopped working, my headphones broke. There was all this weird stuff happening, you know. So I then went off the next day. I decided to do my integration process in the Galapagos Islands, because I was over in that side of the world. When would I next get the chance to go to the Galapagos? It seemed like a good idea at the time. To get to the Galapagos, you have to take 3 flights. I woke up the next day, set off. I still felt weird and dissociated. During that journey, I decided, and this, you know, this is very strange. I decided I'm in a dream. This isn't real. I'm in some kind of alternate reality. I thought either I'm in a dream or I'm dead or in a coma and in some kind of bardo limbo state. When you decide that, everything seems to confirm. If you don't have other friends around you, trusted, loved friends, everything seems to confirm your delusion. So I arrived in the Galapagos and I saw the kind of posters saying, Galapagos, welcome to your dream holiday, or Galapagos, it's paradise. And I thought, oh, you see, this is my subconscious playing tricks with me. I would get texts from my family or photos, and I'd say, oh, this is just my subconscious has created this. You know, like I couldn't get out of this delusion. I remember saying this to a loved one, Louisa Tomlinson, who wrote one of the chapters in the book. Mm-hmm. And she said, Jules, you don't sound great. I think you should come back to England. You know, by this point, I was staying in a hotel in the Galapagos Islands. I remember going out onto the balcony of the hotel room, hearing this retching sound like someone being sick on ayahuasca. And I looked down and there were 3 deck chairs with seals lying on the deck chairs. And I thought, that's too weird. This has got to be a dream. In fact, that, you know, all of this was real, but it seemed so uncanny that I just thought this is some kind of dream. Anyway, I took my friend's advice and I thought, maybe if I get back to England in my dream, I'll wake up and I'll be like, you know, I'll discover I'm in hospital or something like that. So maybe this is the way to wake up from this dream if I go back to England. It was very much like The Truman Show, if you've seen this, or, you know, that kind of thing. So then 3 flights back to England, you know, all kinds of problems I got. I wasn't let on flights because I didn't have the right documents, all this kind of stuff. It was no easy thing. Finally, I get on a KLM flight back to London. And I remember just thinking, being so impressed with my imagination and my subconscious for being able to create such a realistic plane. Like I thought, gosh, these Dutch air stewards are so Dutch. That's so clever of my imagination. And I thought, well, because it's a dream, I'll just upgrade to first class. So I just kind of got up, walked to first class and said, I want to upgrade, you know, here's my dream credit card, and, you know, which they accepted. Unfortunately, it turned out to be a reality. And I got a kind of bill for £1,000, like about, you know, a few weeks later. Finally landed in England. And there was my friend, Louisa, waiting for me in the airport. And it was like the last scene of Inception. At that point, I still wasn't sure. Is she my imagination? Is this my dream, or is she real? And I decided to act as if she was real, to go with it. And when I hugged her and smelt her hair and felt her, I finally thought, this is real. So it was that experience of a hug and of that connection of love which brought me back into this reality. Then luckily for me, my friends took care of me for the next kind of 10 days or so, when I would still suddenly find myself thinking, this isn't real. Like crossing a road, those cars aren't real. You know, that kind of thing. So I still had a rather weak sense of reality, but my friends gave me a lot of love and support, and gradually I kind of came back down. And after 10 days, I was completely back in this reality, though still extremely heart opened. So, you know, during that time, I would have waves of deep anxiety because I was extremely cognitively disabled. I couldn't understand books at that time. I would watch films. I couldn't understand films. I could one-on-one, I could really understand people talking one-on-one to the point where I thought I was telepathically connecting them. But when I was in groups and they were talking about something like jobs, I couldn't understand what they were saying. So I was very cognitively disabled. And I thought, am I going to get these kind of capacities back? Like to be able to understand a book or a film. So I'd have these waves of anxiety, and like Buddhist practices, like riding the anxiety, like following my breath, like reminding myself this will pass, were incredibly helpful. So too was just like friends, love, and support. Just to end it off, I feel like, though this probably sounds a terrifying experience to you, for me, it was basically a positive experience. And the reason it was positive was I felt like I was replaying the traumatic experience from when I was 18, but replaying it with 20 years later with new skills and new capacities. First of all, when I was 18 and I had these bad trips, I didn't tell anyone. I completely closed off. I refused to rely on anyone else for help. This time, by contrast, I had to rely on my friends. I had to be completely open with them. I had to be vulnerable. So that was a replay of that trauma from when I was 18, but in a completely different way, letting myself be seen at my most vulnerable. Secondly, I had training from like Stoicism and Buddhism, which helped me to navigate these weird altered states, using things like, oh, like this will pass, like follow the breath, this kind of thing. So I feel like it was like a spiritual emergency in terms of it helped me to grow. But as Tim will tell you, like I in a way I got lucky. That could have gone very differently.
I just want to say, Jules, when I read your story, I was really amazed on in many points. It really it's really similar to my own experience. I when I was like 20, I tried to do some therapy on myself, on my own depression with psilocybin, and also got, you know, out in the deep end or maybe a little traumatized by doing it myself. And I didn't touch psychedelics for like 20 years. And also when I turned 40, I sort of returned to this field and had my first and only MDMA experience because I wanted to know what the research and the therapy of MDMA was about. But this experience really came when I started to dig into my old experiences. Then it was sort of all this old stuff from my 20s came up, and it really felt like it was like Grof is saying, like a gestalt was closing itself, something that hadn't been finished off when I was 20, sort of processed it or completed itself. But like you, I was in basically an altered state for like 3 or 4 days, and I couldn't sleep, and also I had this also this perfectly similar experience of, am I in a dream or am I dead? Am I really lying in a bed, and the things that people are saying, maybe they are whispering in my ear when my body is lying somewhere else, and all these kind of strange synchronicities, really strange experiences, and also this your description of electronics not working. I really have some really strange experiences with electronics behaving really strange, and I don't know how to understand this.
It is strange, and these synchronicities, a kind of mainstream psychiatrist would say these are illusions, delusions, but not always. I had another friend of Tim and mine, another psychologist called Oliver Robinson, for example, noted in his dream diary, he didn't even know I'd gone to do ayahuasca. He said, dreamt that Jules was having some kind of psychotic experience. And that was in the precise week that I was having. Another friend kind of contacted my friend Louise and said, is Jules okay? I suddenly kind of thought of him. So these coincidences aren't just, you know, illusory. Sometimes they are genuine.
But the intensity of meaning is very overwhelming, and like you described, it's so overwhelming and impressing how your mind can constitute these meaningful events. They are so like a really thought out movie, or it's really high level intelligence. That is how that was my experience.
Well, and I think the usefulness of sharing accounts is you start to see similarities in people's experiences. I was amazed in our collection to see some of the other people in the book also talked about they thought they might be dead, or they thought they might be the only person that was in the universe, or they were in a dream, that reality was, they're seeing the fabrication of ordinary reality. And that can be quite reassuring. Oh, so the mind in extremis goes to similar kinds of places.
And also this thing you describe with the, you know, connecting with your friends, having a hug, feeling human warmth. That was also for me really like feeling the body again. That was also very important to ground myself again. And there was also like a kind of bodily kind of catharsis experience, like all kind of fluids coming out of the nose and like there was some really intense energy, like cleansing the system. And also I had you know, that we might discuss also this Kundalini kind of ecstatic transcendence, kind of powerful energies coming up the spine, that having kind of erotic tingling energies, that kind of. So
can I say, I guess one of the key takeaways both from your story, Anders, and Jules, and also here is the use of a supportive network. That's definitely one thing. And you also mentioned stuff like stoicism and meditation practices. So all components of healthy integration. But maybe we could also talk about preparation if one decides to actually use psychedelics, because sometimes using psychedelics recreationally can also open up, of course. But if one decides to use psychedelics with a more, should we say, poignant intention, what would you say constitutes proper preparation? Also,
Tim was the consultant psychiatrist for the Imperial Psychedelics Lab, and he's just launched a month ago the Institute of Psychedelic Therapy. So I am going to defer to your greater knowledge on this topic, Tim.
Yeah, sure. I mean, just before I get onto that, I mean, it's so moving to hear your account again, Jules. And of course, when I was an emergency psychiatrist, the people that I would see were people who were having these experiences but did not, you know, have benign supportive networks. You know, they often lived in difficult places, difficult family lives. You know, there was danger in the streets. Their experiences were fueled by drugs, and by the time they come to us in psychiatry, you know, things have got pretty bad and their experiences are quite entrenched and difficult to work with. And I guess the other thing I want to say is that I think we all have traumas quite deeply rooted within us that can become accessible when our psyche is open. So I think we probably all have the potential and capacity to, you know, to have these sort of experiences in some circumstances. And it's often to do with opening. And sometimes the opening can be, you know, carefully judged and considered. Sometimes we know we're going to open, like if we do an intentional psychedelic journey. And of course, sometimes it takes us completely by surprise. And, you know, I think it's, you know, as we move in to talk about preparation, I think it's really important to know that we probably all do have these areas that, you know, in a recreational setting might come up as a bad trip, but in, you know, in intentional work, this is the material that we want to deal with often, and it's a gift when it does come up. So when you move into preparation, you know, you're always kind of thinking of this, that people very often have such beautiful experiences, make new connections, see things from different perspective, and will feel bathed in light, and that's lovely, and that's very healing, and that's great. But very often you get the more jagged stuff. Instead of love, you get places of unlove, places of connection. You get places of profound disconnection, and you know, and it's such a valuable opportunity to work with these areas, but it has to be skillfully worked with, otherwise it just becomes a re-traumatization. So again, with a preparation, you're building a therapeutic relationship so that when these things do come up, you know, you can work with them in a way that is likely to be productive, because otherwise it's just going to sear the psyche again. and it's got the potential to make things worse. I mean, if you want, I can give you a brief outline of the sort of preparation that we're doing in the current trials. And I suppose that gives some sort of indication as to how it might be rolled out in clinical practice, assuming we get to that stage. So generally there's 4 layers of preparation before we get to the first medicine session. The first would be a fairly basic screening call, just to make, just to see if somebody's suitable, and if somebody has a past history of, psychosis, or even a first degree relative of psychosis, that is a red, that's an indication of high risk. It doesn't mean you're not going to work with that person, but it's certainly something you want to think about. You want to establish that somebody has the sort of mindset that is willing to work. So it's not all out there. They're interested in the internal process. So that's really the first layer. You'd be very cautious about working with someone with a history of kind of impulsive behaviour that might put at risk. Then the next couple of calls, which these days are obviously done remotely, are really to do with getting to know somebody, their life story, the big things that have happened, the feeling tones, the themes, getting a sort of shape of psychological issues, abandonment, rejection, what sort of stuff might come up. And you're really getting to know them. You're really encouraging them to explore and stay with feelings. Maybe you're forming an impression of what they do with their feelings. You're also interested in what comes up in the body, because we know that in expanded states, the somatic presentation of stuff is so important. So wanting to draw that out, encourage people to, to tune into their body a bit. And then the last preparation is in person these days before the session itself. And then, you're working more with how to work together if difficult stuff does come up. You might practice some breathing methods together. You've probably done that before in the earlier sessions, how to anchor yourself if things get difficult, how to tune into your breath. You might practice some methods of physical support. And, as we've heard with both of you so far, physical support is just so absolutely crucial, that sense of touch in your hour of need, a bit like a mother holding a distressed baby. And often you have to rehearse with somebody, how can we best support you if need arises? Is that going to be hand holding? Is that going to be arm over arm, hand on shoulder, something like that? And you will actually physically try those out, so it doesn't feel too weird, if you need to do that in the session. And it's not that you're just, providing a bit of solace for somebody. It's more that you're walking hand in hand with someone into the cave where maybe their demons are kept. So you're accompanying them so they can go deeper to maybe where they need to go. So that's really the message. So I'll stop there maybe for now.
Yeah. Tim, do you think that it will be possible to avoid these kind of spiritual emergencies when the psilocybin get approved like a therapy? Or, I mean, I guess it's more like a risk with psilocybin than with MDMA. My sense is that maybe these kind of experiences, I mean, both Jules and I had, of course, we had experiences in unsupervised, not optimal settings. But if you do it like preparation, but maybe you reduce the risk. But I think maybe you can still have, people can still have a crisis years after, and maybe they come into this kind of states, or do you think we can avoid it? And how do you think we should take care of that if that's the case?
Well, we probably can't avoid it completely, but I just want to emphasize the absolutely central importance of the relationship. And if you prepare somebody well, you hold somebody through the session, and you take care of them afterwards, it really does limit the risk. And the sessions at Imperial have not had any. I think there was one person who needed a rescue medication in maybe a couple of hundred. It seems relatively low risk. but the screening has been done very carefully. So high risk people have been screened out. I mean, it is part and parcel of this work that it exposes people to deep psyche and intense layers of meaning, and it's inherently risky. So that inevitably has to be some safety networks and safety mechanisms.
So one of the things we've also discussed in the group is the concept of time, not only when you're on psychedelics or having a spiritual emergency, but also the opening that can potentially even take a lifetime to integrate. It can become a life's work. And we've been discussing, well, how can you kind of implement that in a treatment? How do you go about that?
Well, I'm so glad you mentioned that, because I omitted that from what I was saying about preparation, but that's really what we want to instill. That image of a hero's journey, that this is a lifelong journey, and in a way, what we're doing is we're trying to help people to learn how to learn. To keep on opening, to keep on looking for meaning, to keep looking outside, establish paradigms, to welcome in new emotions, to learn how to be in the world in a different way. Thank you for bringing that in.
I have a question, Tim, that we had a very nice talk with an artist and psychologist from our network some time ago. And she described that after her psilocybin sessions, her imagination was more alive. That suddenly, when she was drawing, she could have like a dialogue or almost like active imagination kind of dialogue with inner figures. So her sort of inner life or imagination was becoming more alive, and that was a great thing for her as a psychologist and as an artist. But if it's just like normal, maybe not very educated people coming for treatment for depression, and maybe they suddenly their inner life is just much more alive. Maybe that can be a source of creativity, but it can also be like maybe they will experience their midlife crisis with more like special effects, more like maybe visionary encounters, or that maybe might be interpreted as a kind of bordering to psychosis if they go to like a normal psychiatrist.
Yeah, I mean, it's a great point. I mean, it doesn't seem to be happening at the moment with the people we're working with in the trials. It doesn't seem to happen that they're having more challenging symptoms, if you like, that might be distressing or problematic for them. But I think you're also touching on a point that in the trials at the moment, the treatment is short term, and really you need successive exposure. So I'm not sure if I'm allowed to say this, but with the people that did the depression trial, the depression mostly came back after 2 psilocybin sessions. And the overwhelming feeling was it just takes more time and treatment. My experience working with people with holotropic breath work, which I think in many ways is very similar to psilocybin, is that it takes a few years. And there's a process that you need to go through. Very often you get the initial kind of excitement and awakening and opening. And then often for a year or 2 or 3, you do the gritty work, which is getting down to the layers of trauma, doing the unloved and disconnected bit. And it takes a few sessions of progressive clearing, and it's often quite complicated. But that often seems to be the really important work that you need to do to transform these very fundamental psychological structures so that you really can be transformed. And there are so many paradoxes about doing this sort of work in a research environment. I mean, there's kind of irony that the research is happening in neuroscience departments that generally believe that consciousness is an artifact of synaptic transmissions and chemical processes in the brain, whereas most people that do this work don't think that's the case at all. We think that's an aspect of consciousness, a bit like Newtonian physics is an aspect of physics, but it's not the whole story. In neuroscience, there's a lot of talk about leveraging the neuroplasticity that psychedelics induce. And in some ways, that's quite a helpful way to think about it. You know, that's maybe what's happening on a brain level, that the brain becomes more amenable to forming new structures to change, etc. But then again, you can understand that using completely different language to do with what you were just saying about, you know, your friends, the creativity, the upsurge of energy, maybe the downloading of, you know, of stuff from the collective unconscious. So for so many people, it's such a creative process. So often words don't really capture it, and you know, holotropic breathwork, we try to get people drawing something afterwards because that seems more effective in terms of capturing some of the essence of what has happened.
If it's okay, Tim, it would be interesting for me to discuss a little about the terminology and both the concept of spiritual emergency, but also your very nice title, Breaking Open. That's also a great title. I think just one last time referring to my own experience, it was really, and my experience was an experience of being very open in a sense that I didn't have this kind of membrane that we normally have, sort of like with, and the strange thing was that I had many conversations with people who came up to me and told their whole life story and their traumas and everything. So they were very, and that wasn't a delusional thing. It really happened. It's sort of, I was like feeling that I'm just commenting on your title, because my experience was also that I was like breaking open, and I was so open that I really couldn't move around in the city, because all kind of psychological material from other people was sort of, I had no boundaries, and then there came all these strange connections with people. That was a very, very interesting experience. Also to also people, you know, we normally call psychotic, this feeling of being invaded and don't having your normal shield, but just being too open. I just want to say that's a great title, but I also heard you have some trepidations about the term spiritual emergency, because of course Grof and Christina Grofs introduced it more like it's more than 40 years ago, but psychiatry or mainstream psychology haven't really adopted this term. And maybe, as you said elsewhere, maybe it's a problematic term because, you know, the concept of spiritual, and then you have also used archetypal crisis, but maybe that's also, I don't know if I think that will work, because then maybe people's relationship to Jung will determine if they accept it. What will be, if we want to build bridges and have your psychiatrist colleagues to understand this, what kind of term can we really use? And is spiritual emergency really a functional term? And if we want to get some of your colleagues to understand what we're talking about.
It's so difficult with language, isn't it? I mean, the word crisis is probably generally acceptable.
Yes.
My personal preference is archetypal crisis, and spiritual emergency is a kind of subset of that.
Okay. But of course, it really matters if you think of it as a crisis or an illness.
You can call it a healing crisis. I mean, that's, yes. But some people hate the word healing.
Yeah, but of course, some of the basic understanding here is also that there's a kind of inner healing intelligence in the crisis, really the Jungian or Grof kind of understanding, but that kind of understanding don't really seem to be mainstream in psychiatry either. As mainstream psychiatry tend to see psychosis as a breakdown or malfunction, right? But really looking for the meaning in the madness and the inner healing impulse in the crisis. Why don't they do that?
Well, that's the fundamental paradigm clash, if you like.
Yeah.
Psychiatry has always been a Cinderella speciality. My grandmother told me when she knew I was going to psychiatry that my grandfather, who was a doctor, didn't think much of psychiatrists. And psychiatry has tried to compensate for that by being quite medical and scientific, and you call it medical psychology. And you're like a white-coated doctor who's examining a specimen and coming up with a proper clinical diagnosis and prescribing medicine, a medicine and management plan. The other paradigm, the healing paradigm, the inner healing intelligence, is that the symptoms are an expression of the healing process. So the symptoms are not a problem. There's something good which is happening. It's more like an initiation into something that has the potential for healing. And with that paradigm, what you need to do is support the process. So support the process in whatever way you can for however long it takes. And of course, sometimes that's really difficult. And as a doctor who's used to being sort of busy and phallic and making people better and things like that, it's very difficult to tolerate just being with somebody and being supportive. It's so difficult. So Grof used to say in his training that the first thing you need to do is forget what you think you know, and just be with somebody and support their inner healing process. So for me, because I'd had all my trainings, that was really difficult. I was the backward student because I had so much more to forget.
Okay, I think we're going to move over to some questions for the audience now. Morten, are you the man for that?
Yes. Should I take questions and organize like this?
Sure.
Okay, cool. And okay, so I'll just start out with a question of my own. But before that, I would just like to say hello to everybody participating. It's so nice that you registered. Thanks for joining. It's nice to see you. We're going to have a Q&A session now and open up into discussion gradually. So I'm going to get the ball rolling. But please write, if you have a question you'd like to ask, then please write it in the chat. And I'm being told my volume is low. I'm sorry about that. I hope I go through. So my first question is like the difference between a spiritual emergence or emergency and a psychosis, because they can look very similar, and are they in fact two sides of the same coin, or how do you draw that distinction? I guess I'm asking Tim Reed first and Jules Evans also.
So it's a very difficult question to answer. I mean, in psychiatry traditionally, there's been a neurodevelopmental perspective. So schizophrenia, for example, people have thought it's a brain condition. So there's a distinction between schizophrenia on one hand and, a psychospiritual crisis or spiritual emergency on the other hand. But we now know that those neurodevelopmental models are just wrong. The sort of psychiatry that I was taught is wrong. The brain changes that you see are not so much caused by schizophrenia as by the medication, and perhaps others. So we now know that really it's much more to do with social factors. So again, it's to do with relational issues and what's happened to you when you were younger, adverse childhood experiences, etc. There's a number of ways of looking at it. I mean, one way of looking at it would be in terms of duration and how dysfunctional and disabled somebody is. But perhaps most importantly is the ability to look into the interior, the ability to work in a therapeutic way. And in psychiatry, we see many people who can't do that. Everything is out there. They're not interested in what's in here. But I think the old distinction between, proper psychotic illness on one hand and spiritual emergency on the other hand, I don't think we I don't think there is such a barrier anymore. I don't think we can take that barrier seriously. But I'd love to hear what Jules has got to say as well.
I would add that I think, you know, a lot of this is about the frames that people choose, that we choose for our experiences. There may be people who have similar experiences, and one person says, you know, I don't want to give any kind of spiritual frame to that. This was just something unpleasant that happened to me. And another kind of person might have something that looks from the outside pathological, but they would say, no, this was spiritual. This was very meaningful. So these are not fixed categories that we can just kind of easily put, you go into this one, you go into that one. I totally agree with Tim about, you know, capacity for insight being quite an important thing, but that's not fixed either. That can change throughout an experience and throughout a lifetime. In my 20s, what was completely overwhelming and I had no insight into it, 20 years later, the same person, the same nervous system, but I had grown more capacity not to be overwhelmed by it and to have more insight into it. I think the last thing I would say is that I have sometimes criticized kind of, or at least there's a risk within transpersonal psychology and New Age spirituality of kind of elitism. If you look at the history of New Age spirituality, going all the way back to the kind of Society for Psychical Research, there was a defensive maneuver against mainstream psychiatry's pathologization of mystical experiences. And what certain people did, and this was a class maneuver, was they said, when people like us have spiritual experiences, they are meaningful and spiritual, and in fact, proof that we're part of the evolutionary vanguard, that we are part of the evolutionary elite. So if you read a book called Cosmic Consciousness, any of you read this book by R.M. Buck? Kind of, it came out in 1900, and he said, certain people are having these experiences of cosmic consciousness. And this is proof that we, because of course he'd had one, are the next phase in evolution. We are the spiritual elite. So when we have spiritual experiences, these are, you know, healthy and wonderful. But sometimes they would say, but yes, but of course, other people, when they have, you know, weird experiences, that's psychosis. So this is, I don't know if that makes sense. What I'm saying is that there can be a risk that people in New Age spirituality and in transpersonal psychology kind of bracket off certain experiences and say, when psychosis-like experiences happen to middle-class spiritual people, they're spiritual emergencies. But if they happen to kind of, you know, thick working class people, that's psychosis and should be treated differently. So there's a kind of class issue here, and there's a historical issue here. It's also the case that everyone in our book were middle-class, white, educated people. We could afford to have spiritual emergencies. We had the educational resources. We could take 2 weeks off work to kind of, you know, not be able to remember our name. We had an emotional infrastructure of support. So we postulated in our kind of concluding essay, Tim and I, we asked the question, is spiritual emergency a culture-bound syndrome? What is it like to have these kind of experiences in different classes, different cultures, and so on? And the last thing I would say is some of the things that our contributors said would be helpful, were helpful for them dealing with spiritual emergencies, would probably also be helpful for people going through all kinds of emotional difficulties, including psychosis, like supportive, kind, non-judgmental context, like reminding yourself this will pass, like basic techniques for emotional self-regulation. I mean, people teach things like compassion to people who hear voices, so that it helps them to kind of take, you know, to change their inner self-talk from very persecutory to more kind and compassionate. So we don't need to necessarily kind of maintain this boundary, right? And say these experiences are spiritual emergencies. Instead, that we can learn, like, you know, the same practices that help people having bad trips probably help people having, you know, psychotic experiences. I don't know if you'd agree, Tim. What do you think?
I completely agree. I think that's going to be one of the fruits of the psychedelic paradigm, that we're just going to learn how to be with people in a different way and use some of the integration practices that we use for psychedelics for people who are having spontaneously occurring eruptions of deep psyche. Yeah.
I just want to say, Jules, I'm really glad that you're also bringing like a political consciousness into this. That's really important too, I think, because I had many clients coming from working class environments, and they, when they meet psychiatry, they don't have any means to negotiate the meaning of their experiences. But when people like you or me or my more educated people, they can negotiate and they have support networks, and then they can negotiate the meaning of their experiences. But really people who are not educated and don't have resources, they really this interpretation are really forced on them, is my clinical experience.
Right. I mean, the history of psychedelics is quite elite. It's someone like Aldous Huxley with all his education, and he's bringing in Eastern mysticism and so on. But everything has different packages. I mean, I would think that in the Amazon, or sorry, in South America, something like Santo Daime, you know, like the ayahuasca church there, is not so elitist, maybe not so intellectualist. I don't know. I haven't taken part of it, but certainly like indigenous shamanism is not elitist, is it? It's not intellectualist. So everything, there'll be different packages, different cultural packages. I think of things like Pentecostalism as like working class psychedelics. I mean, I honestly see interesting parallels between Pentecostalism and psychedelic therapy. And people in the world of psychedelics would hate to see that kind of parallel, because they're like, we're nothing like Pentecostalism. We're far more intelligent than that. But these are both forms in a way of faith healing, you know, right? And so
with Pentecostalism, can you elaborate on what this means?
Pentecostalism is the fastest growing denomination in the world. It's like a form of ecstatic Christianity. 35,000 people convert to it every day. It's where you open yourself to the Holy Spirit and you go into a trance state, and often it's very healing for people. So this is like, you know, ecstatic healing on a mass scale.
Should we take another question?
Like to ask yourself?
You've got one from Nadia. What is the youngest age you think a person could do psychedelics at? Tim, what do you think?
Oh, I couldn't possibly say. I mean, I've had this discussion with my son, who's just turned 21, and he's cautiously experimenting with psychedelics, and I'm happy for him to do it because he's got a nice bunch of friends and his ego structures are fairly solid, and you know he doesn't have any trauma. But it's risky when you do it younger.
I understand that the MAPS is actually obliged to do research also on teenagers with the MDMA. I don't know if you heard about that. That's the FDA authorities. They apparently it's a standard medical procedure that you should also test it on adolescents and maybe people down to 12 years. And as I understand it, they're obliged to do that. But I don't know if you know anything about that. But then, of course, it seems crazy, like or risky giving MDMA to 12-year-old people with anorexia or something like that. But apparently that's happening.
I think the more sensible information there is about psychedelics, the more information there is out there, the better people are able to make informed choices. And you know, it may be that we can't do any better than that. If we can get rid of some of the damaging myths of yesteryear, and you know, impress upon people that these are very powerful substances that make you see things very differently, and it's a really good idea to have someone to take care of you.
We have a question from David Talbjerg.
Yeah. Hey, Tim and Jules and Alice and all you other guys. So I have a question on the relationship between early relational trauma and spiritual emergencies. So some of the two examples we've had here, and I want to apologize, I sort of come in very spontaneously and I haven't read the book yet. I definitely want to read it, so maybe it's in there already. But both Jules, you and Anders, you sort of track your spiritual emergency back to too early maybe, psychedelic experiences. But my question is then, what about sort of spontaneous emergencies? What are the cause of these? Do they exist? And also, how does that relate to early relational trauma? Yeah, and for Tim or Jules, whoever.
Yeah, Tim, you go first.
That's a great question and so complex, and you could do a conference on that. I guess my starting point with answering it would be, I think, the Jungian idea of complexes, and Grof redefined them as coexes. It shows how different experiences with a similar range of feeling get clustered together. And this happens so often in, psychedelic states, spiritual emergencies, contact with the deep psyche. So you might get in touch with, an abandonment that, for example, happened when you were a young adult, and then cascade through experiences of abandonment throughout your life and end up with something that is beyond memory. And that happened in the context of perhaps the primal relationship, or in the context of birth trauma, if you like, when it feels as though your known universe is trying to kill you. So I think you can sort of see that there's a sense in which all these feelings have a container within some sort of relationship structure of whatever type. There's always an experience of I here and something else outside, and I think that's one of the reasons why having a psychedelic experience that touches base with those traumas again in a very well-held setting, maybe with the usual parental dyad of the co-therapist pair, can be so intensely healing, because you're being put in touch with your deepest, darkest fears, if you like, sometimes, but at the same time, you're being very, very carefully and tenderly looked after by, the co-therapist pair, which represents in a way the parental dyad. So there's a way in which there's the possibility for some early attachment damage to possibly be repaired.
Yeah, so it's sort of simulating, you're sort of reawakening and opening up to the early trauma, and then you're simulating a new sort of, or the therapist yourself are simulating a new way of handling.
I think that can happen. I think there's always a danger in oversimplifying very complex things, but sometimes it's quite helpful to try to strip things down to component parts, to try to make sense of it.
I would just add that in our book we had 14 contributors, and had early trauma, either in their childhood or in their teenage years. So it seemed like if you have, sorry, my internet's not playing up, but if you have a mystical experience and you have buried trauma, there is more of a likelihood that the trauma might come out during and you might have some kind of difficult ecstatic experience.
Yeah, I think there's a close link between early trauma and moving into the transpersonal. Sometimes going back to those primal traumas acts like a portal into the transpersonal, so you can go back to, a really difficult place, but then move through that into an extraordinarily beautiful place. So often those two go hand in hand.
It reminds me of Donald Kalshet, if you at the trauma of the soul.
I have a question from one Jules Evans.
Oh yeah, I've got a question for Tim. Well, I wanted to ask Tim because I haven't seen him for a bit. I mean, since this book came out last year, didn't it, and during the pandemic, and since then, I mean, the psychedelic market has exploded. Last week, we had a $3 billion listing of Atai Life Sciences, the psychedelic investment company, on the NASDAQ. Lots of startups in Portland, lots of companies getting ready for psychedelic therapy market in other states as well. So what do you think of this, of the shroom boom? Where is the market on this? What are your kind of hopes and fears in terms of this extraordinary, this extraordinary shift, rapid shift in this field?
I mean, I guess money and power plays out in the way that it does. And money and power have obviously, are going to be invested in anything that is new and exciting. So I'm not going to speak to that too much. I mean, since we last spoke, we've been through a global collective spiritual emergency. The pandemic has been extraordinary. We've had the encounter with death. We've had boundaries going up. We've had boundaries coming down. We've had a global coming together. We've had a completely altered relationship with, the things that we normally do. Why is it happening now? Well, the thing that we should all be thinking about most is the planet, our relationship with the planet. I guess the developmental step that we need to make is from a predatory relationship with the planet, a baby trying to suck the breast dry, to a more kind of adult, mother-child relationship, if you like, and have a more responsible grown-up relationship with the planet. And, we're only going to do that if we change our behaviors, and our behaviors have been changed for us. I suppose you could say there's a wonderful synchronicity about, all this going on, and the psychedelic renaissance. And, some people have sort of said this, the plant medicines are maybe reaching out and helping us to think in different ways. And, we have to, otherwise we're not going to, the chances are we're not going to make it. If we don't get this right. So classical kind of psychedelic experience, intensification of meaning, encounter with death, the possibility for things going horribly wrong, and we have definitely flirted with that, and the possibility, if we work hard and integrate it, of change. And I guess we're all doing our integrative work. We're doing that tonight, aren't we? We're all trying to make sense of what's going on. We're trying to make sense of things that we have had difficulty figuring out before. Personally, I feel optimistic about psychedelics. I think, if the genie is let out of the bottle, psychedelics change the way people think. My own hope will be that we will lose this notion that ego rules. So we're the first culture in the history of the planet, I think, that really buys into the ego as supreme, that all consciousness is an artifact of neurochemical process, and that there is no bigger picture, there is no higher power. I mean, how dangerous is that if we really think we are masters of the universe? So I guess my own bias is I kind of like to think that psychedelics have got the potential to connect us with a bigger picture in some way. So as far as I'm concerned, bring it on.
Can I just comment on that, Tim? Because of course that would be my hopes too, that we can reconnect with nature and understand each other, and all these optimists thinking about psychedelics. But I also been a little worried about the pandemic and all this. Jules, you have also written about conspirituality and all this kind of, you might say, paranoid thinking. I don't know, people are, of course, people have many stands on this, and also within the psychedelic community, there's also some differences and some arguments that who is awake and who has seen the light and who's still sleeping. And so I'm a little unsure that actually that we as a culture can handle psychedelics right now, because there's also this ontological uncertainties, so many worldviews and what is real and what is not real, and some people also get into this kind of space after psychedelics. And
it's going to be messy. I mean, as Jules and I have been saying, these things are not pretty. It's not smooth. It puts us in touch with the difficult stuff. And we have to be in touch with the difficult stuff, you know, our past, our histories, the way we are with other people, the way we are with each other. All we can do is connect, be as honest as we can be, as loving as we can be, as compassionate as we can be, sort of look deep within ourselves, you know, find points of, you know, find ways in which we can be together and find a way of getting through this. It's going to be hard.
I agree. And also, in terms of the rise of conspirituality, which is like conspiracy thinking in New Age circles and things like QAnon, in some ways it's been, you know, I've sometimes been encouraged by the kind of antibody response in spiritual communities, like, you know, trying to protect itself against QAnon as this virus that's been spreading through kind of, you know, New Age culture. And so cultures, you know, are self-regulating, potentially self-healing organisms. So hopefully if we are more aware of some of the risks of psychedelic culture, we can mitigate them. So there is a risk of psychedelic elitism and psychedelic kind of spiritual inflation. And you saw this in the 60s. We are the awakened ones, and you are, you know, you're the squares, you know, you're not even really real, you know. So there was that tendency in the 60s towards spiritual elitism and inflation, and psychedelic fundamentalism. Even you can't really get it unless you've tried psychedelics. You can't really have a true spiritual existence. So I don't know. I hope that by talking about it and calling this stuff out, not necessarily shaming people, just saying this is a tendency that can happen, then it maybe makes the culture less likely to repeat those mistakes.
Thank you. Do we have more questions, Martin?
Yes, we have 3 questions lined up. The first one is Thomas, then we have Avilu and Rasmus. So Thomas, are you ready?
I am. Can you hear me?
Yes.
All right. I love your book. We've been talking a lot about psychedelics, but a few of the stories, Louisa Tomlinson and Angela Cotter and a few of the other ones, they have the spiritual emergencies without any psychedelics. And my own travel have started with psychedelics, and then right now it's not psychedelics. And there seems to be this little misalignment or not agreement about people who can access the spiritual realms with no psychedelics, and then people who actually does it via psychedelics. How do you see the difference? I'm just curious, because it sounds like some of the people who can actually access some of this stuff, the more transpersonal realms, they seem to have a hesitation towards psychedelics. And I've been kind of in both worlds, and I'm just curious.
Oh, well, I just thoughts off the top of my head, and then I'll hand over to Tim. First of all, I think, I don't know, it's the risk when you're talking about ecstatic experiences or spiritual experiences is that you say these experiences or this realm of life is spiritual and everything else is just mundane. And so, you know, you can say, oh, these people can access the spirit realms, but where is the spirit realms? Like, you know, everything is potentially a spiritual experience. So I think there's a risk in New Age culture and in Western culture that we say these are special experiences, and then we commodify them and fetishize them. Whilst like, you know, sitting in the park can be a wonderful, wonderful experience, or just, you know, something really average, like you're just talking with a friend. So I don't think, you know, you can bracket off, you know, the spiritual and say, oh, only if you've completely blown out of your head and you're seeing archetypal patterns and geometric shapes, then that's spiritual. But if you're not, because a lot of people go through life and they never have an ecstatic experience exactly, you know what I mean? that doesn't mean that their lives are less spiritual or worthwhile or valuable. So this is the danger of New Age culture, is you say, I'm only really having a spiritual life if I'm speaking to plants or something, so nonetheless, to your point, the reason Aldous Huxley was drawn to psychedelics is he spent decades writing about mystical experiences, full-on mystical experiences, and he never had one himself. So he saw, only when he took mescaline was he able to have this kind of, then he was like, now I understand what all the mystics were writing about. I don't know. I mean, I wonder if Aldous Huxley then contributed to this fetishization of these kinds of experiences, this mass eagerness to have, these special experiences. And he writes The Doors of Perception, and it really creates this desire among millions of people to have a kind of Huxley type experience. I've got to tell you, like, I wrote a book called The Art of Losing Control, and the subtitle was A Philosopher's Search for Ecstatic Experiences. And I went looking for ecstatic experiences, tried these different types of experiences. Now I honestly don't mind if I never have another ecstatic experience in my life. Like, I'm all, I don't know if that answers your question. That was just off the top of my head, but I'll hand over to Tim, and then you can come back, Thomas, because maybe I missed the point.
Hi, Thomas. Thanks for your question. I mean, I think some people are naturally very kind of archetypally open, if you like, and maybe that's partly genetically predetermined, and are open to having experiences that are kind of beyond consensus reality, and sometimes that's more spiritual, sometimes it's much more problematic than that. And the gift of psychedelics is that it is such an effective tool to take you to those realms that otherwise few people can get to. But I think the territory is essentially the same.
Yeah, but wasn't my point in terms of I'm having mystical experiences, because my own path is also like, in the beginning you touched on it earlier. You kind of chase it, and then you kind of develop, and then you kind of getting used to the different mystical experiences. But that's not the point. It's something else. You want to get into your deepest self or whatever else, and then having clairvoyant or healing experiences and all of that, sensing people is something else that's just sidetracks. But it was more, is it the same realms or not? Because some of the people who don't do psychedelics, they tell me that, and I'm in no doubt that they can go and they can just look at you, and then they see a lot of stuff, versus the psychedelics is somehow the same, but a little bit different. Well, I was just interested in your thoughts on that.
Here I can interject with a question posted in the chat from Tina earlier. She's asking about maybe the difference between spiritual crisis or a psychosis. Is one idea would be that if it comes from meditation or from psychedelics or from some kind of spiritual practice, then it's a spiritual crisis. Whereas if you are going about your normal life and suddenly you have an opening like this, then it's interpreted as a psychosis.
Definitely not.
Definitely not.
I wouldn't agree with that. No, because I mean, what you're going to say that if it happens spontaneously, it's psychosis. I don't know. I mean, these are just tricky things about categories and classifications. These are just terms that experience is incredibly fluctuating and mutating, and we try to fix them into kind of clear categories and say this is a spiritual experience and this isn't, or this is a spiritual emergency. These are just, I'm not so interested in the category terms. They're useful. I'm more interested in what helps people through. In some ways, the term spiritual emergency and even the term spiritual experience is saying this is special and mysterious and a bit different. I mean, I would almost just use the term unusual experience or challenging experience. I have friends, going back to your question, Thomas, who see ghosts and spirits and things. And that's just their experience, which is totally, it's not good or bad. It's just about helping them integrate it into a normal life. And that means not being afraid of it and saying this is so awful, this is going to completely freak me out and destroy my life, but also not getting all, oh, I'm so special because I can see dead people. And then it becomes inflation and elitism. So all these experiences are just happening to us. And this is the Buddhist attitude to this kind of experience. They say these are just experiences. Don't be afraid of them. Don't push them away. And don't cling on to them and say, gosh, I'm so special for having these experiences. I'm better than other people, whatever. They're just experiences that happen. And what's interesting is just what helps people to integrate these experiences. And so with all these things, and they can happen to people when they're meditating, or they can happen to people when they're playing golf, or when they're, I mean, like, it is extremely hard to kind of find categories for these things. So I'm just interested in the what helps people to kind of, live good lives, whether they have these experiences or not.
I think that ties greatly in with the next question from Avilu.
Yeah, exactly. I don't know if you wrote about this in the book. I haven't read it yet, so excuse me if I'm asking something that's already in there. But I just wanted to ask if you could actually talk some more about the integration, because like there are different kind of layers, I think, and you talked a little bit about it. Like one thing is integrating if you had some kind of therapy, psychedelic therapy, or like an experience, but also like in the long term, like what is your experience of what helps people, and what is important to not just integrate one experience that you had on psychedelics, but also like using it for something in your daily life. So how does that work, and what is your experiences with that?
Well, that's a great question. I mean, I suppose there's a sense in which our whole life is an integrative journey. But after a big opening, I guess the message is to find a way of making sense of it using the tools that you have available, and that's going to change over the course of time. So after an intentional psychedelic journey, it's really about it's about spaciousness and creating a tender, supportive, compassionate environment, much like Jules was describing when he came back and was hugged and held by his friends. So often that's the crucial first stage. And then, often more abstract forms come first, like paying attention to your dreams. Often artwork is helpful. Often the words tend to come later. Physical safety, good nourishment, grounding activities often really helpful, whether it's mindfulness, gardening, taking care of your body. And then, as time goes on, maybe some talking therapy might be really helpful. And again, you need to be careful as to what sort of talking therapy is right. You don't want somebody telling you the answers. It's more somebody helping you to make sense of something. And then maybe your focus kind of expands a little. Maybe you're going to turn to books. Maybe you're going to start coming to talks like this to try to take it deeper. So that's always the message: is to keep learning, keep growing, try to be as accepting as you can of everything that comes up in your kind of on your emotional radar, and always a message of kind of softness and gentleness. So it's really difficult to integrate if you're really exposed to life's jagged edges. So that needs to be quite carefully judged. When is it right to maybe go back to work, or maybe go back, on the public transport system or something like that. Yeah. How about you, Jules?
Yeah, exactly right. Yeah. We just saw similar things in our contributors in terms of what their experiences were like, and similar patterns in terms of what helped them through. And as you said, it was things like body practices, breath practices, supportive friends, particularly finding a good frame for your experience, not seeing it just as sickness or breakdown, but as potentially something healing. And then people found certain books or poetry that were helpful to them. So we got all of our contributors to kind of recommend their three books that really help them through. I was just teaching a class this morning on Pema Chodron, this Tibetan nun, and her book, The Places That Scare You, which was super helpful to me in that kind of year afterwards. And yeah, and then there are integration circles that people run, like a friend of Tim's, Rosalind Watts, and Michelle Baker in the UK. They run psychedelic integration circles. So there are these kinds of things. There are some communities like the Spiritual Crisis Network, the Spiritual Emergence Network, and yeah, and then sometimes if you're lucky enough to be able to afford it, or you can find a good one, talking therapy is really helpful. I was lucky enough to, my friend Louisa introduced me to Tim's business partner, amazing therapist called Maria Papas Piru. You might have read some of her. Well, Tim and Maria have just brought out a book recently, haven't you, Tim? You just edited a book on psychedelic therapy.
We have. It's called Psychedelics and Psychotherapy.
Yeah. So Maria was my therapist for 3 years. Never met once in the flesh. We were pioneering Zoom therapy before the pandemic, and Maria was incredibly helpful. And it was a bit like Tim said. Like, I remember the first 2 months afterwards, that it was, my ego boundaries were so fluid. It was really easy to get down deep and stuff. And then it turned into kind of slower, grittier work. But yeah, but that was very helpful. But yes, I think we've got to improve our kind of cultural infrastructure for these kinds of experiences. There's very little out there at the moment, and I do suspect that as more and more people take psychedelics and do meditation and yoga, a small percentage of them will have difficult experiences. So if you're in the line of offering integration work as a psychologist or therapist in Denmark, I suspect you're going to have plenty of work.
If I can just add one comment there, our writers pretty much all said that the most unhelpful thing was going to a psychiatrist who says, you've got a serious mental illness, you're going to have to take these tablets for the rest of your life, because that is the counsel of despair.
So I would like to tie something on to what Jules just said about integration circles, is that like, speaking as a representative of the Psychedelic Society of Denmark, I fully agree, and we need more like social infrastructure also outside of a strictly therapeutical setting. So we've done it. I've hosted a few. We should get back on that. So thanks for that reminder. The time is now 9 p.m. here in Europe, and we just want to be respectful of your time, Tim and Jules. We have a few more questions lined up, so we just want to hear if you're okay with going for another 20 minutes or so.
I can't. I've got a hard exit, I'm afraid. I've got to go.
Oh, okay, right. So what do you say, Morten and Anna? Should we let Jules go and maybe stick around after for an after party?
Sounds like a good idea. Thank you so much, Jules. Just some last words from you. If you were to give a good advice for this network, what would that be?
Wow. What I'd love to learn, and I hope we keep in touch, is where Denmark is in terms of legislation, in terms of therapy. So the work is partly kind of, it's interesting, isn't it? Because there's learning about what helps people to integrate, but there's also the kind of lobbying process as well of what will help this to be legalized in Denmark, and who do we need to contact, how to make this happen. So I suppose we can all learn from the States as well, in terms of what places like Portland are kind of going learning. I would say good luck, and I hope it gets legalized soon in Denmark, and I hope we continue to connect as a kind of international community of researchers and practitioners.
Thank you, Jules, and also we hope to be able to invite you, or maybe talk again on Zoom, or maybe some of us will go to Breaking Convention in England or something like that, or another conference. That would be great to meet. context like that. When things like that open up again, we're really looking forward to that.
That will be great. Yeah.
Yeah. So,
thank you very much, guys.
Also, I want to thank you for all your critical work on the spiritual or New Age culture or psychedelic culture. All your articles. That's also very important as a critical cultural analysis or whatever you might call it. That's also very important.
Thank you. Well, yeah, that's my stuff is on Medium and my website philosophyforlife.org. Yeah.
There's some great stuff in there. Great articles in there.
Oh, thanks. Yeah. Well, and nice to see you, Tim.
Bye, Jules.
Okay, bye, Jules. Bye. Thank you.
Bye. Thanks a lot, Jules. All right, so I guess we lost Jules, but we still have
Tim here.
We still have Tim. Very good.
Yeah, we'll hold on to Tim a few minutes more if you don't complain too much.
Yeah. Are you right, Tim? We're sticking around.
Yeah, I'm good for a little longer. Yeah.
Okay, so we have a question from Rasmus. Are you ready to come on?
Yeah, hi Tim. I was just wondering if what your thoughts are on whether the whole hero's journey would be beneficial for anyone, or if there are actually people out there who rest enough in themselves and it would just be opening up Pandora's box and be downhill from there, or if depending on how you go about it, would this be a beneficial journey for anyone?
Well, that's a great question. I mean, I think the hero's journey is probably for quite a small minority. I think most people are really not very interested in going deep into their psyche and, working with historic trauma and doing that whole growth journey. I mean, certainly in psychiatry, most people just want some symptomatic relief. So most of the people that come and see psychiatrists will, quite happy to have a diagnosis and maybe some tablets to take the pain away. And it would be quite difficult to, to persuade them that it might be useful just to stay with those difficult feelings and see what comes up. So I guess the whole hero's journey thing is more of a calling. Some of us are called to do that and very many are not. I guess you can liken it with, the path of the shaman, the path of the artist, the path of the wounded healer. It's kind of if you undertake that journey, it has a quality of a service to community as well, because in a way you're not doing it just for yourself. The heroic journey is you're also doing it for the community. I'm thinking of that wonderful story of Plato's cave, which I suppose is the archetypal hero's journey. The person who goes outside of a cave and acquires this transpersonal knowledge then comes back to the cave dwellers and uses that knowledge for the good of the community, learns to be a wise ruler. But what do you think, Rasmus?
I'm not sure. I mean, some people seem naturally to rest so much in themselves that they don't need to do the hard work. But if you are able to convince anyone, I believe anyone would have some part of themselves to improve or work on.
Yeah. I think the hero's journey metaphor is especially useful for people who find themselves in those in that place anyway, and then it's like you're giving them a bit of a map that helps make some sense of what they're going through, and shows that there can be some growth and gain at the end of it. I mean, so many of the world's, I'm sure you all know this, but so many of the world's kind of great mythical stories are very much on that theme. So it's very, very deeply rooted in our collective consciousness.
We have a question from one Bob Ganesh.
Hi, Bob.
Hi. Yes, I have a question. It's a bit of a dilemma, I think, or a paradox or something. And I'm wondering how you see it, and if you have an approach to how we can go about with that. I mean, it's about in the more spiritual part of the psychedelic community, there's a belief that in the psychiatric hospitals, there might be a lot of shamans institutionalized, hospitalized on mental institutions, because they have had these kind of spiritual emergencies and didn't know what it was, didn't know how to deal with it. They had no one to talk to about it, and they went to the normal doctor and was institutionalized and put on tranquilizers or some kind of psychotic medicine, and actually had a spiritual experience, but it was misinterpreted by a psychiatrist or by the regular system. And the paradox is that in a process of screening who can participate in a psychedelic study or in a psychedelic session, you would often exclude these people who have psychotic episodes, or and perhaps those people are in need of this kind of help, some of them. So I don't know how we can break that barrier between those two things.
Yeah, I mean, you've framed that very well. I mean, the thinking usually is that people who are who have very open psyches and may be in contact with archetypal material of the type that could be labeled as psychosis, but they don't need anything that takes them deeper into that. But the methods we use for integrating psychedelic journeys could also be of help to them in integrating their archetypal experiences. So it's not that you'd want to give them psychedelics, because that's probably not going to be helpful to them because they're in that place already. It's more a matter of how to, make contact with them and ground them and work with them in a way so that some of this material that seems so out of control can become more workable with or useful. And you've spoken to the heart of that spiritual emergency kind of question, if you like, that these people who end up in psychiatric hospitals with chronic, presumably untreatable mental illnesses, if they had been worked with in a different way, could they have gone down a more growthful route? And of course, we don't completely know the answer. The feeling is that with some of them, at least, that might well have been possible. Yes. That's the challenge for, I think, the psychiatry of the future, to find more creative ways of working with people. And in UK psychiatry, we do have teams that try to do that, early intervention services and teams that work with young people with kind of early breakthrough symptoms.
Okay. So yeah, in the early days, I believe that Grofs and others were working on schizophrenics using psychedelics and had some positive outcomes of it. So do you see a possible future where we use psychedelics in the treatment of psychotic patients or people who've been hospitalized for spiritual emergencies, so stuff like that?
Well, it's not on anybody's radar, and Grofs' early work in the hospital in Prague, they didn't usually work with people with psychotic symptoms or who might be classified as schizophrenia. It was more people with psychosomatic problems, neurotic problems, depression. So the main thinking is that would be potentially too risky, and the risk of doing harm is maybe greater than help. But I hear behind your question your concern that some people who could potentially benefit might be overlooked because they don't fulfill the criteria, and you're right to raise that concern. And I guess the best answer is that to not be too rigid in our criteria, and to look very deeply and carefully at people, and and not be careful not to deny people the possibility of change.
I could add that Julia Holland from MAPS, she thinks that MDMA would be good for certain kind of psychotic illnesses, because of course many people who hear voices or have visionary states, also because of trauma. So that maybe MA trauma therapy would be helpful, more helpful than.
Well, yes, I think that's right, and of course MDMA is so good at connecting people with a kind of compassionate state, and so many people who've end up with chronic psychosis are so alienated. They have this huge sense of separation and alienation and despair, and certainly you think that MDMA might be helpful for that. Yeah.
We have a question from the chat, and I'll just read it and then interpret afterwards. But the question goes: what are your thoughts on working with, for example, the Truman Show experience in a new dive versus doing the integration as you described? So what I think that refers to is that it's a kind of spiritual emergence situation of derealization. And the question might be, should you try and do another session if some process was not fully finished, or should you actually just lay off the psychedelics for a while and do bodily kind of grounding exercises?
Yeah, so that's the sort of technical question that I think we should really be thinking about. If people get in touch with problematic material, how to work with that. And how we'd usually think about it is to work with material until it's really fully resolved. So you encourage people to go deeper into something in the session. You try to resolve something within a session, but that doesn't always happen. And then the question is, do you then go and have another session and go to the same material again and work with it again, or do you just back off a bit? And I think that's a great question. And I suppose it's going to depend on the circumstances of the individual concerned. Their support systems, issues of risk and safety, the extent to which they are willing to go back into that, to that difficult territory again, and the extent to which they can maintain an internal focus rather than externalizing things. In holotropic breathwork, which is my practice, if you like, I've been doing it for 20 years, and usually people would have two sessions in a workshop or a retreat on different days, and very often something is unresolved in the first session, and you work on it and more fully resolve it in the second session. And we often use the word complete within the greater picture of incompletion to recognize the fact that sometimes things are never completely resolved, but that they're made more manageable.
I think that's a good answer, and I would also just like to echo that I think it's important to talk to somebody. Also, what Jules said was that in his early days, he didn't talk to anybody about it, and of course, it's hard to find people you can actually talk to about these things, but they are out there. So you can send a mail to Psychedelic Society Denmark, and we'll refer you. Then I think we are also in a place where we should round off again. I think Anas has a question. And I guess
it could be like rounding off comment, because I think it's been a great and very interesting discussion, but I'm still uncertain if I think that the best strategy would be to sort of advance the concept of spiritual emergency or archetypal crisis, or maybe we should just focus on getting a new understanding of psychosis. Of course, as Jules said, the term psychosis is a little stigmatized. It sounds better that you had a spiritual emergency than a psychosis, because with psychosis you might sound like a psychiatric patient or ill or something like that. But the term itself just means unusual psychological experience or something like that. It's logically, I think, and also I'm just wondering, Tim, you said somewhere that psychiatry today is really meaningless in some sense, that it's really symptom management, symptom control and risk management, and it doesn't really look for the meaning in madness. So I think in some sense we are really back to where Jung was 100 years ago when he took the logic of dreams and applied it to psychosis to look for the inner healing impulse and the meaning in the images of the psychosis. I mean, Jung did that 100 years ago, and some people have done it. Grofs has done it, but it's sort of slipped out of psychiatry again, and maybe we just have to reinvent that depth psychological way of looking for meaning in this kind of experiences. And maybe you also mentioned dreams. Maybe it's impossible to understand psychosis if we have a psychology, mainstream psychology and psychiatry that doesn't even look for meaning in dreams. That is, wouldn't you have to understand that there are some basic stuff going on in dreams about healing and meaning making? There are basically the same processes in psychedelic experiences and also in psychosis or spiritual emergencies. If that makes sense, the question.
Well, I guess you're pointing to the tension and the divide, if you like, between people and approaches that are interested in meaning and those that are not. And I guess we're all thinking that the psychedelic renaissance is going to push us more towards meaning-based approaches, and hopefully that is the case, but not necessarily. I mean, you know, I guess there's a real possibility that psychedelics might be used more as a kind of medical model, and you come and get your brain rebooted under medical supervision. So,
exactly. There are some people that are comparing psilocybin to ECT, so that's not really a meaning-based model.
I guess we people who are interested in meaning need to stick together.
Okay. Yeah, it's interesting for me to see that the new psychedelic renaissance is also boosting people's interest in Jung and dreams also. So that's really funny. Actually, my experience right now is that psychedelic therapy is actually becoming more mainstream than dream-oriented therapy. but probably these things go together. Understanding of meaning processes in dream, in psychosis, and psychedelic experiences. That's my take on it. Even though,
I mean, I think what you're doing is great in having these meetings as a forum for cutting-edge discussion about these complicated topics. And you know, we're all trying to make sense of stuff, aren't we? And you know, we're coming together for these integrative practices. I guess we can't do much better than that.
Okay, thank you, Tim. Yeah, should we round up, Morten? We shouldn't hold on you longer. Maybe.
Okay. Well, thank you for inviting me, and it's been a real pleasure being with you all tonight. So I'll say goodbye and wish you all the very best in what you're doing.
Thank you, and maybe we will have a look at you and Maria's new book when it's out, and maybe at some point we can have a talk about this book with you and Maria or something like that.
Yes.
It's just like,
yes,
that would be interesting too. But when will it be published?
Well, it's coming out in September in the US and
okay.
October, I think, in Europe. So sometime in the autumn. It would be a pleasure to come back and speak with you all.
Perfect.
I'm sure you'd love Maria. She's a great speaker.
Yeah, we will definitely have a look at. We will definitely have a look at the book, and I think it would be great to have a talk with you and Maria on the occasion of the book. That would be really great. So I think more definitely. Yeah, sure. Okay.
Okay. See you then. Goodbye.
Yeah. Bye.
Goodbye. Thanks, Tim.